Frontline workers in our area hospitals are quarantining after close contact with a virus. 14 BSA staff members are in quarantine. Some of them are vaccinated. 10 staff members at Northwest Texas Hospital are quarantined. Dr. Brian Weiss with Northwest says they did not have any staff members quarantined last month. Those quarantined staff members are also contributing to a staffing issue facing our hospitals. KMR Local 4's Judd Baker has the latest on that issue from hospital officials.
We've got beds, we just don't have staff.
Northwest Texas Hospital's chief medical officer, Dr. Brian Weiss, says they are essentially at capacity in terms of common things like traumas, and a surge will hit them where they need it most, their staffing.
Our real shortage is nursing staff. And after we lost a lot of nurses that went traveling, a lot of them have not returned to work yet. I know some of them are back in the community, but are not back to work.
At BSA, Chief Medical Officer Dr. Michael Lementier says they're also seeing staffing deficiencies.
It's starting to impact what we do with patient flow. It's starting to impact what we do with selection of certain patients for intensive care versus a step down intermediate care. And as the number grows, it will continue to do so.
Dr. Lementier says nursing resources across the region are being taxed, especially after the departure of the RAC state support we had just a few months back.
And if we get a large increase beyond the number of patients we have now, we're going to have difficulty staffing beds to manage those patients.
All of this affecting current hospital staff.
I'm very worried about a lot of our staff.
Our staff is tired. Our staff is concerned that we're on the uptick of another potential surge. By not moving forward with getting vaccinated, if you're an eligible person to get one, that's imposing on the rest of our community. And that's just the reality of it. It's not meant to be harsh. It's not meant to be in any way condescending, but it's the fact of the matter. We're urging you to take advantage of the resources that you have available so that we can keep people healthy.
Now back to that RAC support, both Drs. Weiss and Lementier say they haven't heard anything from the state about providing that additional help yet. We reached out to the Texas Department of Emergency Management today and asked if there were any plans to reinstate that assistance, but they have not returned our request for comment at this time. Live in studio, Judd Baker, KAMR Local 4 News. Andy.
Judd, thank you. Both hospitals say they are taking steps to ensure the safety of their staff and patients, announcing they'll be limiting visitation for their patients again. Only one visitor will be allowed per patient. They also said they are closing all entrances except the main entrance and the one by the emergency room. They're also limiting the capacity in both the waiting room and the surgery waiting rooms. BSA also limiting visitation at its facility starting tomorrow. They said all visitors must be at least 18 years old, pass a health screening, wear a mask, and stay in the patient's room for the duration of their visit. Visiting hours will continue to be from 8 in the morning until 8 at night. The number of visitors allowed is different by unit.